Thank you so much for being here today, for taking time out of your busy schedules to meet with us as we meet to talk about the first year of Operation Rio Grande and the second year of Operation Rio Grande, which is forthcoming. It's been a really interesting year. It was a little over a year ago that one of the members of our committee here, the Speaker of the House, got up in front of some cameras and talked about some of the problems that we were seeing in the Rio Grande. I don't know if talks about some of the problems really explains what happened at that time, but in a very powerful way, he was able to express some of the frustration and emotion that many of you had experienced and expressed as well. And that led to a meeting that the governor called at the state capitol, and just about, I think, everyone around this table was at that meeting, as well as many in the audience and some in the wings as well. And we had a very frank discussion about what was happening, why it was happening, what was not happening, and what needed to happen. And coming out of that, we were given very specific assignments to try to just figure this out. And out of that assignment, I made a phone call. And really can't emphasize enough how important that phone call was. I called John Pierpont, the director of the Department of Workforce Services, and engaged with him and asked him if he would be willing to help do the legwork, him and his team, and they've done that spectacularly. So thank you, John, for your work, and to his team, many of whom are here with us today. And at that point, we came together and started working together and planning together. And I know we've talked a lot about this, but I can't express enough gratitude for the women and men around this table who worked so diligently on trying to figure this out and did it in a very rapid fashion. We at a speed not known to government very often, not even known to the private sector, but trying to figure out what we were going to do to separate the criminal element from the homeless, our homeless friends, and not just the law enforcement piece. That was obviously the first phase, and we'll talk more about that, but working with individuals and getting them the help that they need. And that meant finding treatment beds. That meant getting help, getting places for people to live, getting places for people to get help, and making sure that they had the medical care and the mental health care that they needed for their struggles. And then from there, helping people to find jobs, the dignity of work piece, the third phase, and bringing that all together. It's something that is not done. There is no mission accomplished banner hanging behind us. You can see that. This is something that is ongoing. There have been incremental strides that have been made. We've made some real progress. We'll talk about that. But there are also struggles left. We found some problems, some roadblocks, some impediments that we knew would be there. This is not a new problem. We found articles from the 80s and 90s talking about Pioneer Park and how we needed to clean things up and fix things. So it's been ongoing for generations. It's not something that, again, will be solved last year or this year or next year. But for me, the important thing is that we're making progress and that we are all working together. And having the city, the county, the state, law enforcement from all of those entities, elected leaders from all of those entities, working with agencies and groups from all of those entities, as well as working with the private sector and especially the nonprofit sector. I want to recognize the service providers in this room who've been engaged in this a lot longer than any of us around this table. We recognize what you're doing to save lives, to improve lives, to help people find themselves and to get back on their feet. And you have been at the front lines of this and will continue to be at the front lines of this moving forward. So it's an opportunity for us to thank everyone. I do want to, this is not on the schedule, I want to turn the mic over to my co-chair, to Speaker Hughes, if you would, to just give a welcoming introduction and your initial thoughts moving forward.
Thank you, Lieutenant Governor. Look, I want everyone in there, just take a mental note. Just put an asterisk in your life and the things that you work on in your life and the things that you experience. And understand that today is a very special day. And the last year that we have lived together through this effort is uncommon. You do not see political jurisdictions that come together that start this is my mental timeline was July 5th, which isn't when everybody got together in that big meeting. But August 14th, if you imagine the kind of collaborative effort that took place from, in my mind, July 5th to August 14th, and that really I believe the Herculean effort that everybody that is here, everybody that has worked together, those that aren't here, the unsung heroes, What we have been able to do in a short amount of time, certainly politically, light speed, is something that we all need to remember. And we need to take inventory of how we got here. And we're going to talk about these issues. We're going to talk about the good things that we know have improved. We're going to talk about the challenges that we have in front of us and what this ultimate goal looks like. But take note, because what has brought us together here today is something that political scientists don't talk about, college courses never discuss. It's something very, very unique, and it's special. And I want to thank you for being here. And we'll get into more. I have a section, and I'm supposed to stay on script. We'll see what happens. But I just want you to know I want to thank you for being here, but more importantly, I want to thank you. Everyone, oh, that's still working. Everyone at this table, but more importantly, everybody that is here at this event today for all that you have done. And everyone knows their role, and they know what they've done in this effort, because it's special. Thanks.
Thank you, Mr. Speaker. Are we still okay with audio for our media partners? Okay. Thanks, everyone. And I know part of the problem with thanking people is that we will miss some, but I mentioned the DPS workers, DWS, social workers that have been involved, our health department cleanup crews, the jail crews, just so many of you have been incredible to work with over the past year. Now, the purpose of this partner meeting today is for the leadership of the three phases to kind of report out on key successes, as well as talk about the challenges the speaker mentioned, and most importantly, the next step. It's where we head from here over the next year. But before we dive into that, I want to recognize Mayor McAdams, who has invited a special guest to be with us today. And I'm going to turn the mic over to him, and he can introduce Amy for us.
Well, thank you, Lieutenant Governor, Speaker. It's been an honor to work side by side with you, Mayor Biskupski, as really the four of us worked so hard on this initiative. President Niederhauser, you've played such a leadership role as well, and it's amazing to see where we've come in the last year. Sim Gill and I started with Sheriff Winder 2 years ago, working with Operation Diversion, that really laid the underpinnings of what would later become Operation Rio Grande. And through that experience, we learned a lot of what worked and what could be improved upon. But one thing we knew through that operation is we could not do it alone. This problem could not be solved by Salt Lake County and Salt Lake City alone. We needed the resources of the state. So we were so happy when Lieutenant Governor and the Speaker stepped forward last summer to work side by side with us to work to address these issues. You know, I supported Operation Rio Grande because I knew all of us needed to work together to address the public safety issues. And that also through Operation Rio Grande, that would be the key to finally expanding treatment options to those who are struggling with addiction and mental illness, mental health issues. Now, I think as the Speaker said, we all acknowledge that Operation Rio Grande wasn't perfect, and we didn't expect it to be. Amid all of its challenges, 1 year later, a lot of good has occurred in our community. 1 year later, I would say the community is much safer. More than 2,600 people have access today to health care through the targeted adult Medicaid extension, and we've more than doubled the number of residential treatment beds in Salt Lake County. More than 140 people today have a safe place to live through our new sober living program, and others through other programs have a safe place to live. We launched the first ever expungement day where hundreds of people sought to erase their criminal records and get back on the track to self-sufficiency. We started the new ORG drug court program, which is now almost full. And as of the beginning of this month, 74% of the individuals enrolled in that program are still active in treatment. There's, as we acknowledge, still a lot of more work to do, and I look forward to continuing on those efforts. But we also always want to be data-driven and track the statistics to know whether what we're doing is effective. Behind the data, you know, that it's not just spreadsheets and numbers and reports, which is important, but behind that data are real people, real lives that have changed. So today, I have the privilege of introducing to you someone, and you know, there's been media reports and other stories that you've seen, gotten to meet some of the real people whose lives are changed. But today I have the opportunity to introduce you to someone else who inspires me, who has done so much and accomplished so much over the last year. She's an inspiration to me and an inspiration to so many others who are following her example. So I want to introduce you to Amy Daschle. Now, before Amy comes up, I want you to take a look at this picture here on the screen. We always love to have Pamela in the spotlight, but this is Amy. This picture was printed in the Salt Lake Tribune about a month before Operation Rio Grande began. So in less than a year's time, Amy has gone from living on the streets to a new life. She's healthy, she's sober, she has her own place, she has a wonderful smile, and she's contributing back to our society. So I've had the privilege to get to know Amy, and really, as I said, inspired by her bravery, her hard work, and her heart. So with that, Amy, why don't you come up? Tell us a little bit about your story. Do you want to come up here, Amy? Why don't you pull up a chair? They want you to face the TV. So I'm gonna put you right here by me and the Lieutenant Governor. They don't want to look at us anyway.
Hello, my name is Amy Daschle, and I'm a woman in long-term recovery. And what that looks like for me is that I have not found it necessary to use a drink or a drug since August 23rd, 2017. My story's not your typical one. I was raised in a loving family, supportive parents, active in my church and a great community. I loved school and was an honor student. I played sports and I went to college. I was married in my church, and I was very successful in my career. I was living what you would call the normal life. It was not until later in my years that life decided to catch up with me. It was revealed that my mother had repressed sexual abuse my entire childhood life. I watched my mother self-mutilate for 15 years, with multiple suicide attempts until the 7th finally took her life. I had a year-long stint with surgeries on a routine procedure, which resulted in me being prescribed 5 30-milligram OxyContins a day. This went on for years. The addiction that I had developed from surgeries, from the prescriptions, was too difficult to bear. My marriage had ended. My father relocated to Texas to begin chemotherapy. I was all alone, no family, and 2 children to raise on my own. All of this in the wake of a financial bankruptcy from the divorce. I relocated to Florida, clean from opiates, to start a new life for me and my children. While I was in Florida getting established, my ex-husband, who had been absent from my children's lives, had came and he took the children to New Mexico, despite the fact that I had full custody. Losing everything I had established in Florida, I flew back out to Utah the very next day to try to regain custody of my children. This was my final breaking point. I fell to the lowest point of my life. My children, who are my life, had been taken from me. I did not have the resources to regain custody to retain an out-of-state attorney. I was nobody in an instant. I relapsed on the pain pills, which very quickly turned into IV and heroin use. I could not bear the pain that I was feeling. I had no way of knowing how to cope. I lost everything. I was homeless, and I lived on the streets for 2 years, literally on the street. I was broken to the core. I was in and out of jail 7 different times. I was broken. I had nothing. I overdosed twice. I almost lost my life to a staph infection when they almost amputated my arm. I was assaulted on the streets, resulting in loss of vision in my left eye. I have seen some very dark things and lived in a very dark world. I was alone. I lost everything. I had no hope. I was to the point of begging, wishing, praying to God that the next shot would kill me. I was arrested multiple times and sat in jail for months, only to be released back on the streets with no resources for help. I was arrested for the 7th time, August 23rd, 2017. This time was different. I was selected to meet with a team of social workers and case managers to discuss my current situation. I was offered treatment and resources, all because of Operation Rio Grande. It is only because of Operation Rio Grande and House of Hope that I am here today. I entered the House of Hope September 14th, 2017, 37 days from my arrest. Most detainees wait months, years in jail waiting for programs. It took me 37 days. It was because of House Representative Hughes, Mayor Ben McAdams, Judge Shaughnessy, Detective Matthews, Chris Egbert, and my drug court team's ability to look beyond the addiction and see the person, not the addiction. Having a belief that all lives matter. That is what truly saved my life. I now have a life that I never knew was possible. I waited in jail for a year, never receiving treatment because I did not have the chronological criminal history to have me eligible for programs. It was only because of the funding for Operation Rio Grande that I was able to receive treatment with the House of Hope, a nonprofit, all-female organization that focuses on intense therapy and trauma, reunification with mothers and children. This program helped me get to the core issues of my behaviors. It helped me rebuild my life and show me who I had always been. They supported me as I worked through my demons, my trauma, my guilt, and my shame. They provided me the opportunity to go to a sober living program. I had the honor of staying with Mike and Renee Brown's sober living, which was crucial to my recovery. Exiting treatment and reintegrating in society is terrifying. Being able to live in a safe, sober community is necessary for transition. I was also given housing opportunities, which has allowed me to obtain my own residence, which I am living in now today. Operation Rio Grande made its sole purpose to help recovering people struggling with addiction from the door of the jail into stability and self-reliance every step of the way. I have hope, I have worth and humility, and first time in my life I have purpose. I see a future brighter than I have ever seen before. Since treatment, I have been very involved in recovery. I work with the Haven Residential Treatment Program, a program that provides a community to rally behind the recovering addict. The love and support this community provides is remarkable. I work with Volunteers of America Detox Facility, helping recovering addicts, offering them a safe place to detox. Housing, treatment options. The demand for this facility is overwhelming. I am now in the process of certifying with Utah State University for the Peer Support Specialist Program. I currently volunteer with YPR, Young People in Recovery, a program which offers services in transition from treatment into society. To be able to give back to my community something that has given me so much has been very humbling and so rewarding. And the overwhelming gratitude I have for the countless many who never gave up on the value of one person's life. I will be graduating drug court this October. We have only begun to scratch the surface of this epidemic. We need to understand as a public how crucial and how special it is to bring the treatment team into the jail, arrange care very quickly, and that the treatment does not stop with treatment. We need to keep supporting individuals with housing and wrap around a recovery support. I am just one voice of many who fight this battle every day. We need to embrace recovery as a community. We need to stop being comfortable with the stigma that surrounds addiction. There are good people out there struggling with addiction, those battling with unfortunate circumstances and trauma, struggling with no knowledge of what resources are available to them. Addiction does not discriminate. Everyone can fall into this disease. We need to focus on decriminalizing addiction and treat it as a disease. Institutionalization is not the answer. We need more nonprofit recovery centers that focuses on the client and not the bottom line. We need housing and sober living availability, therapy-based programs that get to the core issue and not the behavior. Programs that help support people in addiction that are struggling with addiction and how to integrate back into society effectively. The majority of people who suffer from addiction do not have access to treatment. We need to come together to embrace this problem because every life matters and we do recover. Thank you.
Thank you, Amy. That was powerful. My wife just sent me this. It's from Mother Teresa. It says, if someone feels that God wants from him a transformation of social structures, that's an issue between him and God. We all have the duty to serve God where we feel called. I feel called, this is Mother Teresa, I feel called to help individuals, to love each human being. I never think in terms of crowds in general, but in terms of persons. Were I to think about crowds, I would never begin anything. It is the person that matters. I believe in person-to-person encounters. I think that best describes what we're talking about here today. We're going to share a lot of numbers. We've been talking about crowds, and those numbers are important, of course, but we didn't do this because of the crowds. And I know you're not here because of the crowds. We do it because of the individuals. And at every meeting, at every interaction we've had, we've reminded each other that this is about people, real people like Amy with real stories and real problems and real solutions. And that's what's kept us going and what will keep us going this next year and beyond. Now, with that, I do want to remind all of us some of the purposes of Operation Rio Grande, and we want to hear more success stories like Amy's, especially those suffering from substance abuse and mental health issues. And in fact, when we talk about solutions, I think she listed them all for us. We could probably quit and just get to work on those, but we need to talk in more detail about some of them. We did talk about two key outcomes, though, that would help us understand how many people like Amy we were helping. And one of those, the first was to shorten the stay, the nights spent at the shelters, the road home. So if we could shorten the length of stay, we would know we were helping people move through quicker and to get the help that they needed. Shorten the stays in jail as well, 37 days versus months or years. That was critical, getting people the help as early as possible. The second one was to increase the positive exits from the shelter so that when people were leaving, they were leaving to treatment, they were leaving to housing, they were leaving to be with families. So shorten the length of stay and increase the positive exit from shelter. We knew if we were successful in implementing the three phases of Operation Rio Grande that we would see these positive results. And we have some of those numbers now from 2017, fiscal year 2017 to 2018. Some positive news. The length of stay went from 48.5 days to 43.5 days. So again, incremental decrease, 5 days. That's a really big deal. That means we're getting people out, we're getting people help much sooner. And the successful exits increased from 119 to 138. So again, we're starting to see those successful exits start to happen. And now that everything's in place, you'll remember it took us It took us months to get new beds open, right? To get new beds. It took us months to get help from the legislature, and then to get the waivers approved to get the coverage, healthcare coverage to our friends who are experiencing homelessness. So now that that first 6 months was taken there, we expect over the next year to see those numbers improve significantly. These are modest improvements, of course. There's still a lot that can be done, and they don't take into account the work that has taken place, some of which was already mentioned, with housing outside of the traditional measures that these numbers are pulled from. And we've had significant increases there with sober living and other areas. So overall, we're pleased, but we know we have a lot more to do. With that, we're now going to ask leadership of each of the phases to come up here to the front to report out on the successes, challenges, and next steps. So phase 1 will be Commissioner Squires, Chief Brown, and Mayor Biskupski. They were collaboratively working on phase 1. Phase 2 will be Mayor McAdams and your team. And phase 3 will be Randy Shumway, David Garbett, and Stephen Lisenby that will report out there. So we'll go ahead and just move forward with our phase 1 report. Mayor Biskupski.
Thank you. Well, thank you. It's a pleasure to be here and a real honor to be amongst individuals who have experienced firsthand the work that we are all doing together and the benefits that have come from that. As you heard earlier, one of the things that really launched this was the commitment of Salt Lake County and Salt Lake City coming together and creating this pilot project called Operation Diversion, and taking that to the state level and explaining to Speaker Hughes and the Senate President and others how Operation Diversion was helping individuals, but that we needed a statewide solution that required a partnership with the state. And we're very grateful for that partnership. We certainly have seen our successes, and you heard this story here. And we're very excited about those successes. The city has been working very diligently to make sure that what we promised the community happened. And that was, as we cracked down on the criminal nature of what was happening in the Rio Grande neighborhood, we would be offering services, we would be holding people accountable through jail bed space, and we would be following the criminal activity. And as you have heard or seen in the press, you know that state or citywide, crime is down 25% in Salt Lake City, which is unheard of, and a remarkable response to crime. But part of that is because of the community. The community doing exactly what we asked. We asked them to call us, let us know about new activity, where it was occurring, and then we could follow that activity. And we followed it not just with law enforcement, but we followed it with our partners in the Community Connection Center. Individuals who are trained to work with people who are experiencing trauma. And that success, I think, has bared out for us community-wide. So we're very excited about that. Some of our challenges, I will let these two individuals really speak to the challenges that they have been facing and what we have been doing to address those challenges. So we'll start over here.
Thank you. My name's Keith Squires, and I'm here to report on behalf of our efforts with Chief Brown in Salt Lake City, but also the partnerships that have come together as a result of Operation Rio Grande. I still remember in our first meeting, as we were going around afterwards and hearing what the objectives would be and goals, relating this to my experience in my career with what we did in 2002, or actually leading up to 2002 in the Winter Olympics. And because for me, that was one of those milestone operations and experiences for law enforcement, especially in public safety, everybody involved in public safety, because in that case we had about 2 years to prepare for it. And a 2-week operation that couldn't go wrong. In this case, we had a couple weeks, just over a couple weeks.
So you went from a 2-year preparation for a 2-week operation to a 2-week preparation for a 2-year operation, I think is what you're saying.
Exactly. And the challenge here, of course, and the thing that I compare to that is, in the case of the Olympics, no one agency could handle what was about to happen. And we recognize that. One thing I've learned over the years also is that none of our agencies have the amount of resources that we truly need to be able to accomplish all of the threats that we face and the challenges we have in keeping the public safe. Because you always have certain areas where the criminal element is able to push their enterprise and be able to operate and take advantage of circumstances. This was a chance for us to come together, state, local with Salt Lake City and Salt Lake County, and our federal partners also, and work together to accomplish something that truly hadn't been done in this state, I don't believe, since the Olympics. And the other part of this, and I'll just use this for those who sometimes look at things and want things to happen in a short amount of time. When I look back at what happened with the Olympics and our preparation there, we had a chance to move light years ahead in what I saw as far as law enforcement sharing information between agencies, as far as training that we were able to provide to our officers, as far as being able to look at new and innovative ways for us to be able to provide public safety services. The same thing is happening here. I look at my own agency, couldn't be more proud of the ideas and the things that we've learned. We've learned a lot from Salt Lake City Police, other agencies, and being able to recognize, I go back to the first days of my career when I'm out, it's only me and a deputy on for, a whole county, and get a call in the middle of the night, and you know that you show up there and you have an individual who, yes, has broken the law, but you can see that there's so much more there and so much more opportunities if you could only get those resources to this individual at this time. The reality is, in those cases, though, you know that that radio is going to go off again in just a minute, and you're going to have another call that you're going to have to respond to. You don't know what it is. We've employed this past year, as a result of what we're learning, a social worker that works hand in hand with our troopers and agents right in the Rio Grande area, same as Salt Lake City had done. And recognizing the value of that and being able to take those times when you have someone who could benefit from more than just the initial criminal violation. We've employed a canine team that we've had throughout the state, but in this case, it was in my first meeting at the road home with Pamela Atkinson that we shared with Mr. Mikovich the idea of the value of a canine officer being able to help to ensure, because we were hearing that from those who wanted to receive those services that they didn't feel safe inside because of what is being brought into the facility, of the threats that were being made. And we were able to get a single-purpose dog, not your Belgian Malinois that we use for other purposes, but a Springer Spaniel named Ike. And his purpose is to help keep the narcotics out of the center and so that people can keep safe and all the things that go along with that. Outreach officers, another thing that Chief Brown and his team were using in Rio Grande, is something that we found great value in and have been able to incorporate into what we do. The fact that we're planning right from the beginning and recognizing that there was a chance that with what we were doing here in Rio Grande would push the criminal element into other areas was something that we took into account. I put together with my team for the specific purpose, because we have jurisdiction, throughout the state and work with all the agencies, a team that would follow that. If an agency felt like they were having a problem surface as a result of what we were doing in Rio Grande, they could bring that in and we would be able to provide those resources to them. Some agencies have contacted us, and we've provided those services, and we've been able to work together. The bottom line of all the things that I've seen throughout this past year has really been the partnerships. And last thing is for those that, like I said, wish things had moved faster, realize that we have just jumped light years, I believe. There will be generations to come of law enforcement officers who will benefit by things we're learning here that we can share with other agencies throughout the state, that they can recognize that that officer that's out there in the middle of the night may actually have a social worker that's available to them that can come and help make a difference in somebody's life, as opposed to just getting them booked in jail and hoping that all fares well. Thank you.
To that, the accountability and the treatment equals success. And I think that's a reality we are experiencing. That this really wasn't a law enforcement failure, it was a system failure. And the different parts of the system needed additional support, all parts of it. And I think that partnership that you're referring to was critical in treatment beds and holding people accountable for criminal activity, and so the jail bed space, and now housing and employment, all those things are part of this bigger system of being able to help people. So I'm going to have Chief Brown talk about a few things as well.
Thank you, Mayor. Thank you, Commissioner. I do remember that phone call last year, Keith. You said, we're going to do this, and I said, what? And we're going to do it when? And so we have really moved mountains over the last year. And Lieutenant Governor, going back to, we've been working on this for a while. I spent a lot of time in the archives at the Salt Lake City Police Department. We've been working on this for about 167 years. Since about 1851. We're one of the oldest law enforcement agencies in the country. Anyway, moving forward. Yeah. We need to give a shout out to the women and men of the Salt Lake City Police Department, UHP, UPD, Corrections, AP&P. Because every night when we lay our heads on the pillow, those women and men are out there doing their due diligence and keeping that area, the area that we call Rio Grande, safe. And have they done a great job? They absolutely have. Mayor Biskupski touched on the crime stats for a little bit about the city. In the Rio Grande District, and we're talking North Temple to 7th South, I-15 to State Street. That is the block we call Rio Grande. In the last year, year to date, so from January of 2017 to today, or last week, to the same time period, 2018, crime in Part 1 crimes is down 43%. That's amazing. That's amazing. And there are those that would say you've just pushed it. Well, we know we have pushed it, yes, but the mayor speaks to the crime across the city. It's down 26%. So we've done more than just push it. We have really, we have worked so hard to rid that area of the criminal element, but more importantly, to work hand in glove, like the commissioner talks about, is bringing people to treatment and getting them the help they need. And the CCC, the Community Connection Center, which is located at 5th South and 200 West, they have been instrumental. They have been an invaluable tool for us that when we reach those people that really need that help, that we can connect them to the services they really need. That has been amazing. It's been so efficient that a lot of the folks that we saw on the 500 West median had gone. The clientele that we were serving there had moved on to other places. So we changed our model to a co-responder model. And so now you're seeing police officers and social workers going out into the field, trying to reach those individuals that are the most servant-resistant, difficult people that we have to try to provide services support. And it's working. Last year, under the co-responder model, our teams have gone out 121 times. They've contacted over 900 individuals trying to get them services, and they do come in. It's making a difference. You know, a lot of times we measure results in how fast we get to a call or our ability to solve the crime. But when you think about those crimes, that's reactive. That is completely reactive. If you look at the Part 1 crimes, year to date, there are 753 less Part 1 crimes. Those are robberies, those are burglaries, those are assaults, aggravated assaults. Those are the most heinous crimes that we track. I challenge somebody to put pen to paper and do the math on this. That's 753 less victims. That's 753 less individuals that we had to arrest, Keith, and take to jail. That's 753 less people that had to be incarcerated, go through the judicial system, Sim, be incarcerated. That number, I challenge somebody, would be in the millions. That is the preventative work that we're doing down there. And then last but not least, the success is not in the destination. The success is in the journey, and we're all on this journey. We're celebrating 1 year. Have we learned a lot? Absolutely. Is there more work to do? Absolutely. I take a chance now and again to go over and talk with, I call Sean McMillan, the director over at the First Step House, and I talk to him and I say, Sean, can I come over and talk to some of the individuals that you're working with? And he says, absolutely. And so last week I was able to go over and talk and sit down with 4 individuals that had been arrested in Operation Rio Grande. And to a T, they said, Operation Rio Grande saved my life. Amy, we almost could have ended the press conference right after your statement, but they echoed the very message that you delivered today. One individual in particular said, look, I had been on the block, and they call Rio Grande the block. I've been on the block for 7 years. He said, I'd overdosed 5 times. He said, I was done. There was nothing really left for me. Being arrested and taken to jail and given the opportunity to go to drug court saved my life. And he said, look, remember, what you see out there, the optics, that is hell. He said, don't forget and never give up. We appreciate the work that you're doing.
Yeah. So, so we're here to talk also about next steps, and part of what's underway in Salt Lake City right now is we have some permanent supportive housing that will be ready for June of 2019. We also have been dialoguing around what are some of the items that still need to be looked at, and some of our prevention programs. And as Amy mentioned in her particular case, the prevention programs that maybe the state could help kind of double down on child abuse prevention and sexual abuse prevention, those types of things. We also need to figure out our path forward on mental health care. So we're doing a great job on our treatment beds for addiction and those who are suffering from substance use disorder. But we absolutely have to figure out how we're going to get more care into the fold for mental health care issues. And I know many people in this room feel like Medicaid expansion would be ideal to help with that. But regardless of where you sit, we do need to address that mental health care piece. We have some care coming online, but we certainly need more beds. So those are kind of next steps, other items that maybe we need to double down on to make sure that we are doing as much prevention as possible, along with finishing out kind of those next steps that people need to be successful and independent again. Anything you wanted to add to that?
Thank you.
Steps? All right.
Okay.
Thank you very
Mayor.
much.
Thanks to both of you as well. I think it was my task to keep us on schedule, and I have failed miserably, and that's okay. So the next panel, you all have 2 minutes each. No, I'm joking. Take your 15 minutes, you're fine. Mayor McAdams, I think you and your team are up.
Well, thank you. And First of all, I want to thank Mayor Biskupski and our partners at the city and also at the State Department of Public Safety for your efforts to report out on Phase 1. Well, I would love to take credit for Phase 2. I think we all know, Phase 1 was all of us working together on Phase 1. Phase 2 was also all of us, but happy to report out on that, on what's happened there. And excited to present to you the progress that we made in Phase 2. While our work is far from complete, as we know that, we've worked hard over the past year and have added programs and access to treatment and housing opportunities to support so many in our county and in our state on their path to recovery. I was reflecting back, and I've told this story a couple of times, of a Sunday afternoon where we were looking at this, and I think that I had some concerns that we were leading out with a Phase 1 and that Phase 2 wasn't happening at the same time as Phase 1, and worried that this would just be warehousing people with addiction and not ever getting at the root of the problem, and we'd end up making the problem worse, not better. And we had a pretty tough meeting on this. Yeah, there's no AC in the county.
They're really cheap.
Yeah, we're fiscally conservative. And we sat for 3.5 hours and hammered out that. It took a leap of faith, I think, on all of our parts, but a commitment from the Speaker and the Lieutenant Governor to vigorously pursue the waiver, a commitment that we would, if a waiver didn't come through, that we would find a way to do it. And I don't think there was any specificity to find a way. And President, you weren't there, but you didn't know that your checkbook, the state's checkbook, was on the line with the words "find a way." But we took that leap of faith. The county actually, we found some money that we were able to step out with. So those treatment beds, 100% of them didn't wait for the waiver to come through. We were able to open treatment beds within 3 weeks of the operation. So Phase 2 started 3 weeks after Phase 1, where the first beds came online, and then incrementally over the next 6 months, we added those beds. I think we were all biting our fingernails, hoping that find a way, we didn't have to find a way, that the waiver would come through and we'd be able to do it. But it was a leap of faith. And it was all of us, and Phase 2 was all of us working together. I want to turn the time over to my staff who worked so hard on this, and I want to recognize them. Noella Sudbury, if you could come up. Noella did so much work. We hired Noella from the private sector with the promise that this would be a lifestyle job, that, we couldn't pay her in money, but we could pay her in lifestyle. It was a total lie. But thank you, Goldman Sachs, for pushing her our way. Also, I want to invite to the table Karen Crompton, who's the Director of Salt Lake County Human Services, Tim Whalen, the Director of Salt Lake County Behavioral Health Services, and Keely Grifoni with Salt Lake County Criminal Justice Services. Also in the room but not joining us are Gary Edwards. I guess not in the room is Dale Keller, but they've done so much over the last year from the Health Department, removing over the course of the last year 2 million pounds, I guess that's 1,000 tons or 2 million pounds of trash that they've removed conservatively. And also want to recognize Rich Morrow with the Salt Lake County Legal Defenders Association. At the table, I'd like to thank other elected officials, Salt Lake County District Attorney Sim Gill, Sheriff Rivera, who's not able to join us today, but Matt Dumont with the Sheriff's Office is here. And also, of course, Lieutenant Governor, the Speaker, Senate President John Pierpont, Commissioner Squires, Mayor Biskupski for your collaboration in this work. I think I just want to give a special shout out to Sim and his prosecutors. It's rare to have a prosecutor who has a vision of therapeutic justice, of keeping our community safe, holding people accountable for the crimes they've committed, but doing it in a way that is fiscally responsible and compassionate. And so thank you, Sim, and to your prosecutors who have done so much work with this and for their compassion in referring people to treatment in the drug court. So with that, let me turn it over to Noella, and my 2 minutes are more than up.
Well, thank you so much, Mayor, for your leadership on this effort. Without your leadership and work, we wouldn't be here today. And I want to echo your thanks to our city and state partners. I look around this room and recognize so many faces and feel so supported by everyone here at the table and the audience. So thanks to everybody. We've been able to accomplish a lot over the past year, and I really don't believe it could have happened without the collaboration of everyone. So as the mayor mentioned, my name is Noella Sudbury. I'm the director of the Criminal Justice Advisory Council for Salt Lake County and a senior policy advisor to the mayor. I'm going to give the update on phase 2, but I welcome all of my colleagues here at the table to chime in on anything that I may have missed or that they want to add. I have the great privilege of being able to share the great work of everyone here. So please jump in at any time. I know you will. So here we go. And we'll go fast. I know we're crunched for time, so I'll keep an eye on it. Okay, so this slide shows the phase 2 initiatives that we've been focused on this year at the county. So huge expansion in residential and outpatient treatment, the targeted adult Medicaid enrollment, which has been critical to our success in this effort. And thanks to the speaker, to Representative Dunnigan, and all those at the state that assisted with that. We started a brand new specialty court program. We started a new sober living voucher pilot program, and we launched our first ever expungement day. So that's kind of an overview. And then these slides will go into just a little bit more detail about each of those things. Okay, so this first slide shows the residential treatment expansion. And this has been really exciting. Since Operation Rio Grande began, we have added 243 residential treatment beds, which, to give you a sense of what the impact that has more than doubled the size of our residential public treatment capacity in Salt Lake County. This has just been so huge as a result of the targeted adult Medicaid, and was key to this effort. I want to thank the providers too for, in response to all of this, really scaling up. And as you can see, we've experienced a lot of growth very, very fast. Tim, do you want to add anything to that? Okay. So here are some of our treatment partners, and I won't go into detail here, but First Step House, Odyssey House, Valley Behavioral Health, House of Hope, Volunteers of America, Project Reality, and Clinical Consultants. Thank you so much for all of your work. And also our state partners. The State Division of Substance Abuse and Mental Health has been hand in hand with the county the whole way with funding, support, and partnership for everything we've tried to bring forward. That collaboration has been amazing. Partners of the Department of Workforce Services, for your funding and leadership and employment support. Thank you for your efforts in the State Office of Medicaid. Rolling out the targeted adult Medicaid expansion was not an easy thing to do. And they came forward with the funding, the implementation, the education for how to enroll, and have just done a phenomenal job. So thank you to all of our partners. This next slide shows the targeted adult Medicaid extension enrollments. This data is pulled, it's pulled for everybody in your handouts, and it shows the enrollment by month since we started. So it passed in November of last year, and since then, through mid-July, statewide, we've had 2,656 new individuals who now have health coverage. These individuals, as you can see by the eligibility categories, are some of the most vulnerable individuals among us. Those that are chronically homeless, in the criminal justice system, in drug courts, mental health courts across the state. To be able to have health care for those individuals has been absolutely key to this operation. The number just below that is the total individuals treated by Salt Lake County contract providers. So unfortunately, we can't tell you all of Salt Lake County how many people have sought care, but we can tell you what we've seen with our provider network. And since Operation Rio Grande began, we've been able to help 784 unique individuals get substance use or mental health treatment, which is a huge success and very exciting. Tim, do you want to add anything to that?
I just want to also recognize the great work of Representative Dunnigan and Speaker Hughes in pushing this forward. Okay.
I think it really shows Salt Lake County treatment providers are exceptional, and I know you guys know that, to be able to add all this expansion, but it really is about resource, and this Medicaid waiver is huge. It gave us an IMD waiver, which allows us to treat a lot more folks in a residential facility, and it's a game changer. So having a Medicaid expansion like this, it wouldn't have happened without that.
Great, thank you. And that is a great point to add. Anything else, Karen? Okay, look at us, moving right along. Okay, this slide shows just some summary statistics on that new drug court program that we started in September of last year. I just want to recognize quickly a lot of the partners from that drug court program who are in the audience. I saw Rick Schwimmer from the Administrative Office of the Court. I remember meeting with him last summer and talking about the accelerated timeline by which we needed to start this court, and he was pretty wide-eyed and not sure if we could do it that fast, but the courts really came to the table in a big way and were very supportive. Judge Shaughnessy is also here. He's the judge for that new court, and what a smart, compassionate human being he is. It's just been an honor and privilege for me to watch him engage with the participants in our court, and we feel so lucky to have him and have him just clear his calendar and jump right in to start this new court. Obviously, Criminal Justice Services, who provides the case management for the court. Thank you, Keely and Alicia and Chris and some of the other case managers. I can't see you all, but your work has been critical to our success. The Legal Defender's Office, Sim, your prosecutors have been terrific to work with, and Sim has always been so supportive of things like that, and that makes such a big difference to have a prosecutor that believes that people can get well and is supportive of recovery. And then the Unified Police Department, I saw Sergeant Lowry here. Thank you so much. I have to tell you, the detectives that work with this court are some of the most compassionate human beings I've ever met, and as individuals are phasing up, they all mention Detective Matthews and Unified Police. They just are so supportive of these individuals. They offer rides, they give them their cell phone numbers, they take them to the doctor, they move them into their homes, and to have that support is really incredible. So thank you to all the partners. As you can see, a lot of great work. We have 113 who pled into the program, and 74% of those in the program are actively in treatment today, which is an incredible retention rate. So we're so proud of this, and that is really due to the judge, to the case managers, to all of our providers who are providing that treatment. Anybody want to add anything to that? Okay. Moving right along. Okay. The next couple slides are going to be about the new sober living program that we launched in January. So the purpose of this program was to provide safe and affordable housing for people in addiction recovery, to help clients transition back into the community and achieve self-sufficiency with ongoing support for their recovery, and to provide a less costly alternative to residential treatment and free up some of that capacity for new clients in need of that level of care. So what we saw in our system was that due to the lack of affordable housing, people were staying in treatment for too long. They were clinically ready to move on, but we didn't want to discharge them to homelessness. And so by freeing up, so what we realized with Tim's help and the mayor's help is, well, that's really expensive rent if all we're doing is at $125 a day, keeping somebody in a warm place. Let's try to partner with the state division, with DWS, and figure out an alternative. So that was kind of the history of that program and the purpose of it. We also know that residential treatment capacity is limited. So by moving people when they're ready, you then free up those residential treatment beds for individuals that are incarcerated and waited for that really valuable space. So this has been a great program. The overview, we first got $300,000 from the Department of Workforce Services, collected a lot of data on the success of this program, and are happy to report we got another $300,000 to continue it. The referrals come to Salt Lake County from case managers and treatment therapists, and eligible clients receive a voucher that covers a 6-month stay in that housing. We have a lot of sober living partners that we partner with. I saw Mike Brown. I don't know if there are other sober living providers there, but we partner with The Haven, with Sober Living Properties, Odyssey House, First Step House, Wasatch Recovery, Legacy Management, The Haven, Recovery for Sober Living. So great partnership there. Here are early outcomes. So since January, we've been able to provide safe, sober housing, a place to live for 143 clients. We have an 81% success rate, and we're defining that as individuals who are still housed and sober on the path to recovery, or individuals who have had neutral or positive exits. So they've moved back in, reunited with their family, have transitioned into independence. So we're really happy with that success rate. Below you can see we've also had some negative exits due to jail, relapse, or disappearance. Treatment is hard, staying sober is difficult, but we're pretty happy with where we are. And the last bullet there is the cost savings. So we've saved $724,513 by transitioning clients when they're ready into sober living facilities. And we get there by comparing the cost per day, $125 for treatment, versus between $360 and $800 per month for the sober living facilities. So it's also saving our system money is the right thing to do. So, Tim, anything to add there? Okay, we're cruising through. We're almost done. Okay, expungement day. The next slide, a series of slides, talk about the first ever expungement day in Salt Lake County. But before we start with that, I really want to thank Commissioner Squires and our partners at DPS for their collaboration and support on this. BCI was terrific to work with, and you were unwavering in your support, and it was so amazing to work together on this event. So thank you. So the purpose of this event was to help individuals move on from their past mistakes. Having a criminal record makes it really hard to get housing, to get employment. So to be able to get people out of that criminal justice system for good is critical. To streamline the process, it's hard, it's a clunky process, it takes a long time, it's very expensive. So to provide financial and legal assistance to individuals who are struggling to navigate this process on their own. To prevent the next Operation Rio Grande arrest by providing a permanent pathway out of the criminal justice system and not have them burdened by that criminal record for the rest of their lives, and then to learn from this experience about the barriers in the current process to hopefully improve the process in the future. I'm not going to spend too much time on this slide. I'll give you the short version. So we wanted individuals to know this service was available, so the Salt Lake Tribune published an article in February saying we're going to have this expungement day. Call us if you're interested, and had no idea what the response would be. And to my personal voicemail and to a staff member that I worked with, we received 471 phone calls. We could not keep our messages clear long enough for the next caller. So just overwhelmed by the need and interest in this. As I mentioned, BCI agreed to review applications in advance and issue those certificates, making it so when they met with the lawyers on the day of that event, there were individuals who could actually complete the expungement process, which that doesn't happen in our criminal justice system. It takes 12 to 18 months to expunge a record on average, and we're doing start to finish, March to April 5th, about a month and a half. So to grant individuals that opportunity and help them afford it was just such a rewarding, amazing thing to do. When we brought the judges together, we brought all the partners together to streamline that process. Thanks to the help of DWS and our partners at the state, we raised $19,200 in private donations to help cover the cost of this event. So these are just the volunteers and partners. Won't go through everybody. It was a packed house. A lot of volunteers. Just want to thank the Utah State Bar for assisting with the volunteer attorneys. We had 40 attorneys who volunteered their whole day to go down to Catholic Community Services and sit with people to help them expunge their records, which was just amazing to be a part of and incredible to see more partners. I'll show you a slide of everybody in here. This is from the Catholic Community Services security camera. So it's a very poor quality picture, but I was so busy running around with the event that I didn't get a chance to take pictures, but it gives you a sense of just how many people were in there, rows and rows of attorneys, partners, Department of Workforce Services, people helping with housing, people enrolling in Medicaid. So here are stats from the day. We got 191 certificates of eligibility from BCI to expunge 191 convictions. 73 individuals who received legal assistance that day in clearing their record, 47 people connected to housing, treatment, health care, or other services. So just a terrific event. All right, so those are all of our great updates. We have 2 more slides, one on our challenges and one on year 2. So this slide talks about some of the challenges we've been having. While we've had tremendous growth in our system, we have struggled with staffing those facilities. And there's a lack of, because we needed more treatment, there's been a lack of social workers to support that growth. And when you increase the capacity by 243 beds, you don't have that infrastructure to report it, results in a lot of, to support it. It causes a lot of growing pains. And this is something that we're still kind of going through and struggling with and trying to think of solutions for how we can get more people to go into this field and support, hopefully, continued growth. Lack of affordable housing. I know everybody knows this. You want to solve homelessness, we need to invest in housing. That's an ongoing challenge and a focus of next year. Continued lack of treatment. Even though we've seen this huge expansion, there's still so much need, both for residential treatment and detox capacity, outpatient levels of care. In the wake of the opioid crisis and the rise in methamphetamine, there's a lot of people just on the street who need help. And even though we've seen this growth, we've got to grow more. And that's going to continue to be a challenge. Those beds, it's my understanding that they are full every single day. As soon as somebody comes out of them, somebody else is there to take their place, and we have waiting lists still. So amazing growth, but it's going to be and continue to be a challenge. Rise in co-occurring disorders and mental health issues. Very, very difficult population to treat when you have both of those things going on, and we're doing great things, but we got to do better. And then the last challenge is really the need for more structured program options for particularly misdemeanor level offenders, those kind of in the justice court system that never really have charges that would get them into drug court typically, and are never spending very long in jail. They're just hard to reach, hard to show up, hard to help. And so more options for them, and thinking innovatively about how we can help these people that are high utilizers of all our crisis systems, the ER, the shelter, the jail. They just churn and they spin. And year 2, we're going to be really focused on how we can stop some of that. But continuing challenge.
Yeah, so thank you, Noella, and everybody. I just want to say in conclusion, we have one more slide, which is potential year 2 initiatives. We discussed some of that. I know we are past our time, so I just want to say in conclusion, first of all, the work of consensus building, you think that it's maybe just Diet Coke and French fries and we sit down and we come to an agreement. It's not. It's actually pretty ugly, the work of consensus building. To the media's delight, they've caught most of those instances of consensus building. But I want to say, while it has been interesting and entertaining to some, it has been a pleasure to work with these individuals up here. I know that consensus building has happened amongst elected officials. I know amongst law enforcement and prosecutors and different arms of law enforcement and public safety. The work of consensus building, it is relentlessly hard, and I'm grateful for the work that you've done. I also want to just recognize, this Operation Rio Grande would not have been possible if the groundwork hadn't been laid with Operation Diversion. And I want to thank Salt Lake City and Salt Lake County, especially the Salt Lake County Council. I remember those early conversations around Operation Diversion, and the council asking me, so you're asking us to fund this for a year and then what? Because we basically broke the piggy bank. The council was willing to break the piggy bank to fund this, knowing that it would end after a year. And then what would we do? And not only were they willing to take that risk, but they actually pushed us to do more. And the hope was that we could lay some groundwork, we could do some learning and have some successes that would pave the way for a broader partnership and a bigger partnership, that the long-promised investment in treatment beds would come, and that we could show on a small scale that treatment does work and that it is an alternative to incarceration. So I want to thank the Salt Lake County Council, Salt Lake City and others who put forward several $1 million in Operation Diversion and several million more to fund the early months of treatment through Operation Rio Grande, and for having that confidence. And not only, again, not confidence and trust, but they actually pushed us to do more, and unwavering support from the County Council, and we'll thank them for that as well. With that, we'll turn it back over to Lieutenant Governor.
Thank you, Mayor, and thank you, Salt Lake County, to your team. While Stephen is coming up, I'll let him know he has 30 seconds, so I hope they enjoy their 30 seconds. I do need to just touch on something that the mayor spoke about, this idea of consensus building. He talked about that Sunday meeting, and I think that was a real seminal point for all of us. I remember I was at church with my family. I left them, and we all came up on that Sunday and just hammered it out. We had to have those difficult conversations, and it is ugly sometimes, but it was absolutely worth it, and I appreciate you pointing that out. I spent so much time with the speaker that at one point my wife just said, you realize you're talking to the speaker more over the course of about 3 or 4 months than you are with your, oh, now I've offended everyone. Who unplugged us over there? There we go. You're spending more time with the speaker than your family, and maybe you should just get a room together. And so that was what was happening over the course of several months. I appreciate it. I also want to give a shout out to Salt Lake County. I said something in a recent meeting that I think was taken the wrong way, talking about the preparations for 2019 and what's happening there. And I just want to apologize for that. The work that has been done by the county preparing for that transition has been literally years worth of planning and incredible work going forward. I can't thank you enough for what you're doing and what you've done with this and what we're going to do moving forward. So I just want to thank all of you for that. Now, dignity of work. You're on the clock. Stephen, go ahead and take it away. And you can introduce everybody as well.
Thank you very much. You saved the best for last, and we're excited to help. So on behalf of the Dignity Work Committee, a few of us are here to represent the great work we've been doing, what our challenges are, and what we see next steps as. As you're aware, our committee began a little bit later than the rest. We began in November under leadership with Steve Starks. We really appreciated his leadership. We recently changed leadership, and now Randy Shumway is helping lead our committee, and he sends his regrets in being able to be here. But I'm surrounded by two great men who've been actively involved in this committee effort since the beginning, not only personally with themselves down in the safe space in Rio Grande area, but with their team as well. So I want to give both of them just a quick moment to share their role on the committee before we go into talking about our successes, challenges, and next steps.
Thank you. When the Other Side Academy was approached about a year ago and asked to come on board and help with dignity of work, to be able to help this group of people, the most marginalized in our community, the people that had long-term drug problems, people who have spent their life in jails, on the streets, in prisons, we were honored. To be able to come in and do the coaching, the workshops, and help them one-on-one to mentor them. And we realize at the Other Side Academy that we are not the answer for everybody, but we want to be able to provide the answer to anybody who is looking for it. So whether we do it at the Other Side Academy, whether we do it while we're doing presentations in the jails, whether we do it in the weeds, on the streets, face-to-face with the homeless population, whether we're doing it with dignity of work, wherever we are doing it, we want to help as many people as we possibly can. Through dignity of work, I know firsthand what programs like this and organizations like this can do. I was a drug addict for over 25 years. As a result, I spent over 20 years of my life in and out of jails and prisons. And folks, when I wasn't in prison, I was homeless. Prison then became my home. So when I was afforded an opportunity to go someplace that taught me the dignity of work, that didn't just teach me the hard skills of work, but the soft skills, knowing how to get up every day, go to work, follow instructions, be on time, listen to a boss, and do it for hundreds, if not thousands of days in a row until I recalibrated my moral compass and became a human being, and then was ready to reintegrate back into the community, to give back and become a productive member, I know it works firsthand, so thank you.
David Garbett with the Pioneer Park Coalition. The Coalition has had a front row seat to see many of the major problems we struggle with in this state, domestic violence, opioid addiction. And Operation Rio Grande has had such an effect on this, far beyond anything that we expected. And I hope you know, all of you at the table here today and those who have supported not at the table, how meaningful that is to us in the neighborhood and how much we appreciate the great work that you have done. It has been incredible. Thank you very much. It's been an honor to work with this committee to try and contribute to finding ways for us to target a specific population, help them get back to work, help them to address many of the problems that they are confronting. And I don't want to steal Stephen's thunder, so I'll leave it at that.
I don't often being referred to as having thunder, so thanks. So, it's a great partnership. This Dignity at Work Committee is an absolute perfect model for public-private partnership. It was set up that way from the beginning. The reason why it's successful is because there's a significant amount of collaboration that's happening. The entire committee is designed to be able to have a cross-collaboration approach, and it's amazing to sit in those meetings and brainstorm and think about innovative ways to be able to reach this population that has unique needs and timing. We've come a long ways in our few months that we've been involved. We've had several successes, as you're aware. We've been able to work with 333 people to establish personal employment plans. One of the key things that Steve Starks made sure we stayed focused on as a committee when we began is that we would have to know these individuals at a very personal level, that we would count successes on our hands. And the entire approach has been that way. In fact, the groundwork for our approach is to be able to first to get to know an individual before you begin to identify solutions for them. And so to be able to work with 333 people in a volunteer approach is pretty remarkable. We have dozens of employers who have pledged to hire individuals that are currently experiencing homelessness, and they have made 221 jobs available. That's just amazing that those employers would take on that opportunity to work with these individuals. From that, we've seen 106 individuals become employed, and we're beginning to track these individuals to see what their job retention looks like, and it's good. Those individuals who come ready, stay engaged in the activities, and then get connected to an employer that's willing to be a mentor and support for them, they're finding success. It's really cool to hear the stories from the Dignity of Work employment counselors, to have conversations with supervisors, working through barrier resolution. It's added a layer of team depth to that employer, so that when barriers do happen, which they do, they're able to work through those. And we have countless examples. One was just spotlighted yesterday, and Mayor Biskupski was a part of helping lift up our framing cohort training program. And if anybody caught the news article that came out yesterday with our good friend, he is up early in the morning and riding his bike and getting on a train, and he's out working with BMC, who's willing to work with him and develop his skills. And we have numerous other examples of individuals that want to work and want to be a part of something bigger. I remember the very first Dream Team event with Oakland Construction. We did not anticipate Oakland would offer jobs on the spot. Halfway through the event, Oakland pulls us aside and says, "Hey man, we want to offer jobs. Can we offer jobs?" Well, yeah, offer jobs, right? We learned a lot of lessons from that day, right? There's a lot of preparation. And there were individuals that day that worked really hard, but were not in a position to be on site at a workplace. And they had to work through those issues. But there were some that were immediately offered employment. And it was a powerful day for all of us to realize that we could do this together. And we've continued to have those experiences. We have challenges. It's difficult to locate and communicate with this population, as well as it is difficult to keep them engaged in this voluntary process. Losing cell phones, being transient and where you're able to sleep at night, those are real challenges. Some people don't want to change, and they're not ready to change. My good friend here on the side, Dave, 20 plus years, okay? But staying available and accessible to individuals, there are moments that will be added upon, and they know we're here when they're ready. There's a lack of hope, self-confidence. education and skills among the people. Often, it's not technical skills, but it's healthy habit formation skills, the ability to manage critical thinking and working through their day. We recognize that the closure of the downtown shelter and decentralization of those services with the addition of the new resource centers is going to be a challenge for us. We're now going to need to work with different organizations to provide these resources at multiple locations now. We've been working very closely with Catholic Community Services and their amazing leadership team and having those services in a one-stop approach. So we recognize we're going to need to be able to replicate that now across other locations. So our next steps include working with Shelter the Homeless and the shelter operators to ensure every resource center has an integrated dignity of work model as an emergency shelter exit and employment retention strategy. With that, we've added an individual, Preston, to our dignity work committee to be able to help work through preparation of what the operators model will look like. We also recognize with our next steps that we need to work with Shelter of the Homeless and the coordinated entry manager to deliver employment as a diversion strategy. There are some individuals who have a work history, and if can be engaged right up front is entry into a shelter, their stay could be very short and they could find employment. We have employers available, ready to hire. We also are going to work on testing an incentive program to engage job seekers in dignity work activities. That's one of the things that David and his team have been working on, is to be able to survey this population to understand what their needs are, what inspires them, what their barriers are, and within a few weeks we'll be testing an incentive process to keep people engaged and coming back, and hope that we can learn from that. So we're excited as a committee to continue all of our next steps. We have about a dozen other tactical items that we plan to pursue. All of them are have strong touch points to phase 1 and phase 2 partners. Some of our best success we're seeing right now is with our drug court participation. It just strengthens our ability to work with somebody on an employment goal when they have another partner at the table with them. And so we'll continue to work with all the partners in the first 2 phases and make sure we have strong connections. So with that, we appreciate our time and saving the best for last.
Thanks, you guys. Thanks so much. Really incredible work that's going on there. All right, next up, we've asked President Niederhauser to provide us with a budget update, and he'll be followed by Speaker Hughes, who will summarize the next steps and the goals for year 2. So, Mr. President.
Thank you, Lieutenant Governor. It's hard to believe that it's been 1 year since we started this operation, and it started off with a few principles that we thought were important. That was enforcement, that was identification and assessment, that was treatment, that was creating an environment of safety and security, and sustainability. Those were some of the principles that we laid down as we started this year. Have there been some hiccups? Yes. Have there been some controversy? Yes, there has been. Bringing a bunch of entities together, they're not used to working together. Those things are going to happen. But the outcomes have been significant. And we've laid the foundation for for more significant outcomes in the future if we can hold on and continue this effort and the energy that we exhibit over the past year. The legislature met last September and during the general session in January, February, and March, and have appropriated $15.4 million in state funds towards this effort. That's just part of the funds that have gone to this. The county, the city have also appropriated funds. There's been law enforcement, there's been treatment, a number of different things that we've needed to fund. For the state's portion, Workforce Services, John Pierpont and Company, are the ones who have been administering and distributing the funds that we've appropriated. And to this date, after having worked with Salt Lake City, Salt Lake County, DFCM, or the Division of Facilities, Construction and Management, and the Department of Public Safety, and many other entities who requested money, that money has been either through contracts or agreements has been obligated. There remains about $600,000 that is unobligated. There are three areas that probably need some consideration for some funding. That is to cover the cost to restore Rio Grande Street to its original condition, funding DPS to cover costs beyond March 31st, 2019, and funding to the Department of Workforce Services for dignity of work activities. We're going to continue to follow up with the entities. Their fiscal years have just ended on June 30th. They're closing their books. We'll find out what the real numbers are in a few weeks. Workforce Services will continue to work with those entities. I think we'll have some more detailed information, financial information this fall. Finally, some of the Rio Grande operation costs were funded one time by the legislature. And so the legislature is going to have to address those ongoing needs in this upcoming general session because this is a multi-year and maybe a many-year process. I think Noella highlighted one of the significant issues that we're facing here as a state. Working in the real estate industry, the real estate development industry, land is at its all-time high, cost of construction, labor, the fees that we pay to cities, permits, impact fees that are at their all-time high. And now we're seeing interest rates rise, mortgage rates rise. Housing is more expensive now than it's ever been. And that's a big issue for many who are struggling to make payments, to provide housing, food, those basics of life. So we've got a lot to do. There's a lot of work to be done here in the state, but we've shown through this partnership, and I just want to thank the Speaker and his leadership, for the Lieutenant Governor and our mayors, for everyone, our department heads, and all of you who have willingly decided to get on the bandwagon and work together. I can say without any question, we've had a significant success over the last year.
Thank you, President. I'll tell you that, again, if you look at politics, you have a Speaker of the House, you have a Senate President, or the leadership of the legislative branch, and you will find at times that...
Until December 31st.
Yeah, by the way, we're still on the clock. No one looked past us, okay? But you've seen in the past, maybe the House and Senate, maybe some healthy tension or just that checks and balances that come with the two bodies, one old and slow, House of Lords, one the arena. No, but I will tell you that the relationship I have with President Niederhauser is a dear friend, but our working relationship and the trust that we have in one another, and really some of the trust you've placed in me, President, in terms of this effort on the legislative side. I just appreciate you, and I appreciate the opportunity we've had to work together. And I think that working relationship has helped contribute to the ongoing success that we're having here. So let me just say, to all those phases that we just heard, the updates that we were given, I want to thank everyone. I want to thank our Mayor Biskupski had a meeting with her city council that she had to leave, but I wanted to thank her and let her know and publicly let you know that this has been hard. This has required real leadership to work together, to come together. I don't know if anyone knows here, but we're not always from the same party. It's not always been. It's not a working relationship that we've all been doing for a long time before now. But it has required us and our staffs to work together in a very close way and in a common goal. And I think that it has been a successful and continues to be a successful effort. And so I want to thank Mayor Biskupski and law enforcement, Chief Brown, Commissioner Squires. I have benefited from getting to know him on a more personal level. This operation is Herculean. I keep joking that our highway patrol have the word highway on their patch, okay? That's not urban policing. And yet, our troopers, our Department of Public Safety, they have come and stretched, and they've done something that they have not been necessarily trained specifically to do, but I was on a ride along this morning with a trooper, and there's serendipity going on here. There are people that are experiencing law enforcement in a way they'd never before, but with the community outreach as well. And that's a beautiful thing, and I think there's a desire to see that leadership and see that partnership that's gone on and goes on in this 2-year operation extend even further. And I would obviously support that, because I think that there's just been some wonderful, unexpected benefits that have come from the working relationship that we've had. All law enforcement, how they've worked together and how they've coordinated together has been unprecedented, and it has been an example of leadership for us as public servants to learn from. Commissioner Squires, we were speaking last night, or we were communicating last night. We had a terrible tragedy with one of our firefighters in Draper who was killed in the fires in California. And as we reached out, our office reached out to Commissioner Squires, they were well within the process of dealing with that. And I was late to that effort in terms of all the work that this man is doing and that public safety does on behalf of our law enforcement and our public services that are coordinating together. And we had a missing child that was up in Wyoming and on a hike, and there's instances that come up, and they are handled at the highest level and with a degree of compassion and attention that I just want you to know those things are happening above and beyond this effort here. And I've gotten to learn that about you, Commissioner Squires, and I appreciate the leadership that you bring. On our dignity of work, Lieutenant Governor was passionate on all levels, but particularly this one, making sure that there was somewhere to go when you're talking about addressing the wolves, and you're talking that are preying upon those that are vulnerable. When you talk about having behavioral health and opportunities for people like Amy described, where she has an ability to get back on her feet. But what happens next? That ability to be self-reliant is critical to this process. And the Lieutenant Governor and Department of Workforce Services and Stephen and David Garbett and David that from Other Side Academy, that we've gotten to know their processes, and it's not for everyone, as he mentioned, but I will tell you, if there's a way that a judge will say, you can go work and we don't have to find a treatment bed or a jail bed, oh my gosh, you see these numbers we're fighting out here? I mean, that's an incredible opportunity, and their role in this has grown, and our understanding of their mission has grown. And so those efforts that are happening, there's just so many stories behind every one of them. I've had a dumb grin on my face this whole meeting, because there's stories attached to every one of these circumstances that have been described. Mayor McAdams has been incredibly patient with me. I'm just going to come clean right now. I was one night at the beginning of this, it was actually in July before we started this. I'm trying to impress my wife about how much I'm learning about this whole issue. And honey, we have law enforcement, but you can't rest your way out of this. You have to have the behavioral health, and I'm talking about the multifaceted effort that we are embarking on. And I bring a lot of material home from the Capitol, and my wife she watches and she observes on her own. And as I was trying to sound knowledgeable about this, my wife Krista called me out and she said, "You're just parroting what the county and Ben McAdams gave you in the pamphlet that's on your table." And I said, "No, I am not. I've been in a lot of meetings. I've been learning all this. I created this. Okay, I've been listening, getting feedback. I've been organizing this." And she went into my office, pulled it out, and said, "This is it right here." And it was Operation Rio Grande. I actually was plagiarizing everything. Okay, I really was. I didn't even know it. I really didn't. I wasn't. And I called Ben, if you remember. I called him and apologized because I really thought I was coming with all these great ideas on my own, and all I did was steal it from the mayor in the county. And so I'm just coming clean now, because that's the kind of patience he never told me. It's like a guy talking about simple math to a math professor. I'm saying, this is how we need to do this. He didn't even let me know I was just taking all their work. But anyway, that's just an anecdotal story, but that just shows you the kind of patience and the kind of cooperation that we have been immersed in for the last year, more than a year. But let me just say this, there's more to do. I don't want this to be too much of a love fest, even though there's so much appreciation I feel for everyone here. There are specific goals that have to be realized in the coming year. And I want to talk very specifically and on the record about what those goals are so that we all know how much work is left to be done. On phase one, on our public safety, we do have a disbursement that's gone on. We know it's not person for person, what we saw here last year, but we do know that that has moved. And we have to be vigilant about that. And we have to make sure that our communication with local law enforcement, not just Salt Lake City, but even beyond, that those chiefs of police, those law enforcement agencies know that the Department of Public Safety stands at the ready, and we have budgeted for the resources and the ability to help where illegal activity will be going on anywhere in the state of Utah and where our help as a state will be needed. And so that requires a continued effort in communication. That really it requires citizens, as Mayor Biskupski mentioned, to be involved and send us their issues or their concerns as they happen, because oftentimes when I get feedback and I reach out to the commissioner, he will say that he's reaching out to law enforcement, making sure people are available, but sometimes the ships pass each other. And so we got to make sure our communications get stronger. We have to make sure that those that are feeling the disbursement that's happening know that we are here and that we are prepared to deal with that and address it. And again, it's we're not going to overpromise and underdeliver. I'd like to do the opposite. I'd like to underpromise, but then overdeliver in terms of our ability to address disbursement. Also, the safety issues of the road home, that is an ongoing effort, and that needs to continue to improve. There's been much improvement. There's been a lot of honesty where we have to really look at our processes and look at whether we can do the jobs that we're doing better. I think there's been that process or that exercise that's taken place. And what we've learned is that things have gotten better, but things can continue to get better by way of safety around the road home, within the road home, around that area. And so the safety issues, so that those that are seeking help feel safe enough to receive that help, has to continue and even improve from where we are today. There's more to be done there. The jail beds. You see that we count them onesies and twosies in terms of trying to find availability. Jail beds, treatment beds, those are the two areas where we are just fighting to make sure that we have the accommodation for. And on the jail bed side, we want to make sure that that those that are really criminally motivated, that are preying upon people that are vulnerable, that we are able to continue to create accountability for that and create a climate where if you need a hand up, this is the place to be. If you are here to profit on the misery of others, this is not the place to be. And there is a difference. And as was explained to me in the ride-along that I had this morning, there are even different social climates and echelons, and you cannot afford, and you in the room know this especially, you cannot afford to look at everyone under the same lens. It's not the same thing going on in every circumstance. There are different stories, even different environments out there in terms of what's happening and the issue that we're trying to address. And so understanding that and making sure that we have those jail beds for that ability to help protect people that are vulnerable needs to continue. That's the public safety. Second phase, on our treatment beds. I met Amy. Don't feel bad if you saw that picture of her from the Tribune. She gave me that picture. I was at a drug court graduation, and she approached me and introduced herself to me. She sent me that screenshot of that front page newspaper story where she was there, and I didn't believe it. I did not believe that was her. I just thought that was typical fake news. You know, they're trying to make it her, but it wasn't her. It couldn't be her. Because look, did you hear her? Did you hear that story? I love that more than the data. I know we need data, and you've had a lot of it today. But as the Lieutenant Governor pointed out, it is that individual, and there's more. There's so many more that are like that are part of this. What that tells me is that we have to do that. We have to step up our game. Those drug courts, the reason why Amy was able to be able to receive help was specifically because of the resources that we put in place. You would have otherwise needed a much longer criminal history. You would have needed to have gone through what she had gone through for much longer to qualify for the finite slots of our drug courts. absent the kind of effort that we put in place. We need more of that. We need more of those kinds of courts and those opportunities for people to receive help. The date that she shared that she's been sober is the date that she was able to take advantage of the drug courts or the specialty courts for Operation Rio Grande. If that isn't a green light for policymakers to do more of that, I don't know what we would need to see. So we need more of our drug courts. We need more funding for those. Here's a good problem to have. We have probably more beds, but we don't have the people. This isn't funny, actually, but we need the people to hire. We need people that can treat those that are in need. We have a manpower shortage or a workforce shortage. Like I said, if you're going to have problems or challenges, that's a great challenge to have. But that means we have to get to the schools. We have to get to those that would be trained and prepared to serve or work in this field. And we've got to be more aggressive about getting workforce on the ground and available. And that is a challenge. And that's one that I was surprised would be a challenge, but it is. So we need increased training and recruitment of social workers. These detox centers that you've heard about. There is a very specific correlation between the detox centers and getting people the opportunity to have help and maybe opting out of or not having the arrests and the jail beds that are hard to come by and having them populated, but having these detox centers available. We need more of them. And I think we have the track record now in the last year to show how effective that is in having these facilities and having this opportunity for people that are willing to take it. We've got to have more of them. And I think that, again, we've got now a year under our belt where we can show that that trajectory should grow and we should have more of those centers, resources available. Again, expungement. You saw that poor Noella had 400 calls herself. I mean, it just the demand is there, and we need to meet that demand, and we need to give people the opportunities to be self-reliant. If that's what we're in this for, we've got to be better at it, and we see all the evidence out there that there's that demand. We got to meet it. So that's the area and that's in phase 2. In phase 3, I think that one of the things that's been mentioned is the people that need the self-esteem and the confidence that they can become employable, that they have not only just the desire to be so, but as was described by David from Other Side Academy, the other issues of being on time and doing the things necessary to hold a job. Sometimes that's going to take longer than an employer that has a position ready to hire someone if they're ready to work. And so that work has to get more aggressive, and we have to have one of the things that's been a beautiful for me, an unexpected benefit, something I didn't think of when we talked about the being workforce ready, was the devotionals. To be spiritually fed, to know that there's great worth in every single human being and that they can meet that potential and they can be something different than the circumstances they find themselves in. And that devotional and that regular opportunity to have some spiritual replenishment has been powerful. And I think that we need to acknowledge that and thank Pamela for the work she's done in that area and other areas as well. But it's incredibly important. I've added in here physical fitness. I think that we put some money towards this where we think that people that take care of themselves and start to see some pride and some dignity in being healthy. There's a lot to be said for physical fitness and how someone pursues that and how that can feed into the other things that they're after. We can do more on that front as well. So we have to continue to build hope and confidence with the population that might not take full advantage of employment opportunities. We need more workshops. We need the devotionals. We need good communication with those that have or are willing to hire people, and we need to strengthen the communication with those willing to offer employment. And ultimately, we need to see the ongoing cleanup efforts. We need to go to those camps. Again, my ride along, we did the outreach, and we talked to people that were kind of camping, and that people, our law enforcement know in the social outreach that's going on, know people by their names, but we need to encourage them and inspire them to leave that circumstance and climb higher and do more, and they can, and they want to. And there's incredible people that you meet as you immerse into this area, as you know. I asked my staff, I said, this is called Operation Rio Grande. It's acute. It's 2 years. But what it's talking about is helping people that are in need, finding the safe services that they need, being able to, through dignity of work, help people, encourage people to be self-reliant. And those principles that we are pursuing in this operation are things that we were doing prior to the launch of Operation Rio Grande in terms of the state funding the resource centers. The model that I was stealing from Mayor Ben McAdams, we were already embracing those concepts. Our justice reform that Representative Hutchings passed in 2015 and that we have looked to increase funding for the justice reform initiative in the subsequent years, that is an overall mission that the state, its other jurisdictions have had for quite some time and will absolutely continue beyond this next year. I have right here, I asked my staff, to that end, what have we done as a state? What has the legislature done? I have 17 pages of 4 legislative sessions of funding and programs that run the gamut of the public safety, but the behavioral health and it's comprehensive. I was shocked that it was 17 pages chock full when I asked our staff to research this, to understand the magnitude of our investment long term. So you have a state, you've heard today that we are committed to this, and that there's much work, as I've just laid out, to do in the next year, but I think we have an incredible track record and things that we have learned from in this first year that we will leverage and that we will expound upon and make better in the second year. And then beyond that, I don't think you'll see these stakeholders leave this space. Many of us have been on a constant email chain or text chain for more than a year. That doesn't go very long without us continuing to talk and dialogue. I got 3 missions when I went on this ride-along. Things I said, I walked into my staff and said, hey, this one, we got to get this done by end of business. I think this one, we just can't, this one needs to be solved now. We just got to do this one. This one's, I can't believe that it's even an issue. So we're going to keep working on that, and I'm going to spend every ounce of political capital I have left to the end of this calendar year, because I'm still on the job. I still have it. I'm going to do it. And I appreciate everybody's work that's been here. I know we're out of time. I know I get abused by the attorney. By our lieutenant governor, he mocks me because I talk too much. And no, he does. Don't lie. You do. It's okay. I embrace it. I know I talk too much. I'd like to do this. I would just like just a little bit of time for those stakeholders that are part of this effort that are doing so much that we haven't. You heard from the elected officials. You've heard from us. I'm going to put Matt Melville on the spot. I'd like him to at least start. He called me the other day, just on cloud 9. They did an incredible, and this is kind of scary, surveys, analytical data on how they're providing their services, some very blunt review and feedback about how they're doing their job. That's scary to do. It's scary to ask, we're putting our heart and soul in it. Is it working? It's not something that's easy to accept, that kind of scrutiny. And Matt, I'm sorry to do it to you, but would you just explain it, if you could, just what you've learned from that exercise, but what's going on with our Catholic Community Services and the work that you've done in the last year? I know that you've done so much and would just love for it to be kind of part of this meeting.
Sure. Thank you for this opportunity. And thank you for coming down a year ago and putting your office up right outside of ours so you could see firsthand all of the things we were seeing day in and day out. When people ask, I just want to cover a little bit about safety. We've been asking our clients about safety, how they feel within the Whalen Center. And people have been asking me, our volunteers dropped last summer because of the incidences that were happening down there. Our staff members didn't feel safe. And just to give you an idea of how much a year changes, about a year ago I was riding into work on my bike dodging drug dealers left and right. Now I'm riding into work and I'm dodging e-scooters. I just can't win. But it's changed a lot. It's much better down there now. The streets are cleaner. But we also want to know how we are doing. So we've contracted with a third party to basically give our clients a voice. Their name is Pulse for Good. They're doing a lot of great work. And one of the questions we ask of our clients in the Whalen Center is how safe they feel. Right now, as of this morning, we have over 200 responses. This is a survey similar to Google reviews where you've got 5-star ratings. 5 stars would be perfect. So right now, our clients have rated us 200 responses. We have 5-star ratings. 62% have given us a 5-star rating on safety within the Whalen Center. The second highest percentage is 4 stars, and that's 14%. So you've got almost 76% that are 4 stars or above on safety. We want to make sure it's a safe place for our clients. Our staff members are doing just a great, great job. And I really want to thank the stakeholders, DWS, for extending the hours of the Whalen Center. We're open 7 a.m. to 7 p.m., 7 days a week. This is a great, safe place where people can get in connection with the eligibility, dignity of work. We've got Utah Community Action there, Salt Lake City Justice Court. It's a great place for people, and it's exciting to see what the clients are saying. A lot of times their voice is drowned out, or it's a footnote. But hearing Amy, stuff like that, and hearing the clients making that voice as loud as possible is really important. So that's all. Thank you.
Thank you, Matt. So I got like 8 texts, okay, telling me that we're like a million hours past, so maybe my grand idea is really going over like a lead balloon. So we should have another meeting before everybody leaves. I'm the only one sitting here asking people to come up and talk about their experience. So I'm going to stop for all of your benefit. Just last, John Pierpont, he's been unbelievable. When I have an issue and I say, I can solve this, you know what I'm really saying? John Pierpont can solve this, okay? That's, I don't say that out loud very often. I don't admit that. But it is actually the case. His guy is taking on a lot. You talk about highway patrol outside their element. I think some people signed up at the Department of Workforce Services thinking that was an office job, not out at the Rio Grande job. So there's been incredible stretching and people working outside of where their comfort zone is. And I can't thank John enough for the work he's done. Okay, Lieutenant Governor, I'm sorry. Okay, here you go. You can have us back. Never give it to me.
Thank you, Mr. Speaker. I will say this. One of the concerns I do have when we're talking about next steps is, as was already mentioned, and I take this very seriously, we are losing both the president and the speaker from the legislature come January 1st. That concerns me. There is kind of this almost band of brothers. we've all, and sisters, we've all been through this together. I worry that we lose that commitment from the legislature where you lose your passionate voice. There was nobody that was going to tell you no when it came time to getting that $15 million that was so important and the funding. And so we will, my commitment is that we will be finding ways to keep you involved because we need you. And I still feel that they will be afraid to tell you no, even though you don't have the same amount of power over them. And that's going to be very important that we keep that continuity where we can. So thank you, Mr. Speaker. Ladies and gentlemen, thank you for staying here with us for this time. I know this has been a long meeting. It's been a very important meeting. The things we've been discussed about, we've been taking notes. We will be moving forward. There will be additional meetings after this on those next steps, making sure we get them implemented. This is absolutely critical. We said in that very first press conference that this was not a 1-month operation or a 2-month operation, that it was at minimum a 2-year operation. I hope this proves that there were a lot of doubters. I hope this proves that we are committed to that we are not finished, we are moving forward. And I also think it's important to point out there's been a lot of, we got our money's worth out of this with the $67 million. That number keeps being thrown around. Most of that money was repurposed using incremental funding from existing resources that we're using. There are new dollars. We mentioned the $15 million coming from the state. That was new money that was being used for this. But I think it's really important to point out that what you saw in these presentations today is a foundation. It's a completely rethinking of the way we provide services, rethinking about the way we respond to those who are addicted, those who need help. The combination of law enforcement with compassionate outreach and services. While it's been out there, it's been siloed for too long now, we're mixing those together, we're merging them in very smart ways and using data-driven decision making to do that. What that means is what happens over this past year and this next year is a foundation moving forward. This is where we're going. This isn't just something we're doing and then stopping. This is a complete rethinking about the way we deliver these services, and hopefully a way to help people get out of homelessness, get away from addiction, get help for their mental illness, and become partners in the American dream. So that's what this is all about. It's not just about what was that 15 million this year. It's what have we created moving out of this. And with that, we stand adjourned. Thank you.